it's always slightly puzzled me, this, because you've got this great wide spinal canal. And yet it would seem that it requires a lot less space once the nerves all emerge from that canal, because of course there's the canal's taken up by and the names are escaping me at the moment, but the fluid in the spinal cord,
cerebrospinal fluid,
yeah,
yes.
and so on. So it would seem that there's a lot more room for a disc to bulge without causing any problems.
There is, and some people have a constitutionally capacious canal, which is a lovely alliteration, but they have a nice wide canal. And other people have a constitutionally narrow canal. So if you're unfortunate to have a narrow canal genetically, the risk of you having complications from a relatively small disc bulge are greater than for people who have a large canal space.
And for that, we will give people a handout with the detail that's on these slides after the show, because some of it will be difficult to follow on a screen, and some of it's quite detailed. But this is just telling us what the cauda equina is and what the syndrome actually refers to.
Yes, so the nerves of the cauda equina emerge from the conus as we described. They travel down, and most importantly, they supply the bladder, bowel, sexual organs, the saddle area, which we'll describe what the saddle area is, and the lower extremities. And the syndrome results from compression of one or more of those nerves. Rarely is it only one nerve, because if it's a large disc bulge, which most likely is the cause, it's going to compress the bundle, and you can see that on an MRI scan. And essentially, once you get compression of the cauda equina, and you have the symptoms that go with it, because simply compressing it isn't enough. In order to have the syndrome, you have to have symptoms. Once you get compression with symptoms, then that becomes the surgical emergency that we talked about earlier.
Yes, and I suppose one of the challenges is to try to identify the problem before the syndrome emerges, where possible. Maybe we'll come on to that in a wee while. But
yes,
it's by that time, I don't know, it's possibly not irreversible, but it's getting dangerous, isn't it?
And that's the critical point, is getting the timing right. So most commonly, the cause of cauda equina syndrome is a large disc bulge. And statistically, most commonly will happen at the L4-5 disc, around about 57% from the literature, but L5-S1, the next most common, than L3-4. Degenerative stenosis is another condition that can cause, central stenosis can cause it, but because the condition progresses much more slowly, you often find that the cauda equina will find a way through the blockage, and it's much less likely to cause symptoms. And if it does, it's a slow progressing kind of glacial sort of event, rather than that rapid 24-hour to 1 week sort of event.
Yeah.